MMT, combined neck extension. Assist the patient to the prone position with the head off the end of the table, the arms at the side. Stand at the side of the patient, supporting the head of the patient at the forehead. Passively take the neck through combined extension by supporting the patient's head at the forehead with one hand and at the chin with the other hand. You are not assessing the infield. You are determining how much range the patient is able to move the neck in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to perform combined extension. Stabilize the patient across the upper back. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include trunk extension that brings the shoulders off the mat and trunk rotation. The patient may also perform only capital or cervical extension. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient across the upper back. With one hand, apply resistance to the occiput and have your other hand placed beneath the overhanging head, prepared to support the head should it give way with the resistance. The resistance is applied in a downward and forward direction. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in combined extension and holds against maximum resistance. Grade 4, good. The patient completes full range of motion in combined extension but breaks against strong to moderate resistance. Grade 3, fair. The patient completes full range of motion in combined extension but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Keep the patient in the prone position with the arms positioned at the side. The grades 2, 1, and 0 therapist position is to stand at the side of the patient. Support the head with your hand at the forehead at all times and stabilize the patient across the upper back. Instruct the patient to attempt combined extension. Grade 2, poor. The patient moves through partial range of motion of combined extension. For grade 1, maintain the patient's head supported at the forehead. You must now palpate both the suboccipitals and the cervical extensors by placing your fingers at the base of the occiput and cervical region. Again, ask the patient to attempt combined extension. Grade 1, trace. Palpable contractile activity in both the capital and cervical extensor muscles with no movement. Grade 0, no palpable contraction.